Kalangala district, an archipelago of 64 habitable islands, has lush vegetation offering an idyllic view. Remote and isolated, these islands are enveloped by poverty and its population is without basic social services. The common means of transport to and around these islands is by water transport across the pale blue waters of Lake Victoria. During an assignment a fortnight ago, we stumbled upon Ruth Nansasi. 6 months pregnant, she was clinging on hope that a good Samaritan would transport her out of the islands. For 4 days, she had waited in vain for her family to raise money to move her to Masaka Regional Referral Hospital. The nurses at Kalangala Health Center 4, which is the best facility around, had told her it's where her pregnancy-related complication would be better handled. Nansasi needed about 40,000 shillings to travel to Masaka, but her family could not raise the funds. The nurses wanted her out anyway to create space for others. Giving birth can be tedious, painful, and can result into death. The World Health Organization estimates that about 830 women die every day, or roughly one every after 2 minutes, because of complications during pregnancy and childbirth. Uganda's maternal mortality rate is among the highest in Africa and in the world, according to the World Health Organization. It is said that 15 women die in Uganda from pregnancy and child-related causes. 94 babies are stillborn and 81 newborn babies die. This equates to about 69,000 deaths each year due to complications during pregnancy. Many of these deaths are from causes that are largely preventable. Mothers die mainly as a result of 4 factors: bleeding, hypertension, unsafe abortions, and sepsis, while babies die mainly due to complications of prematurity. If you happen to be looking for a prism to see the extent of this crisis, then Kalangala offers the best case study. The National Health Policy recommends that a general hospital should serve a population of 500,000, a health center 4, 100,000, a health center 3, 20,000, and a health center 2, a population of 5,000. But it's a deplorable situation for Kalangala with a total population of 54,000 according to the last census. Filian Keronega, a senior medical officer at Kalangala Health Center 4, the only standardized facility in Kalangala, told NTV that they cannot do much for patients, yet the referral system itself is costly. Patients have to travel for long distances on water to reach Kalangala Health Center 4, and referred to the nearest health facilities off the island.
They are very expensive in terms of cost and transport to access the facility, and when we refer these people here, they have to cross the mainland, which is equally expensive. So it becomes sometimes very difficult for us to be able to provide the right services. Whereas referral can write a letter referring the patient to, but you end up when you go one time to go sometimes because you do correct outreach clinics, you will find the client has not gone back.
Kalangala Health Center 4 is in a near to deplorable state. It lacks basic drugs, yet it serves a population of 10,000 in its catchment area.
When they upgrade this place, we think most of the services will be made available in terms of, first of all, human resource will improve in terms of medical personnel, the doctors, the nurses, any other people who are able to offer specialized services. Like now, for that lady, we shall maybe one time get somebody who's a skin care specialist. The size of the theater is going to cater for different kind of clients, not only cesarean, but also it will be extended to other, because right now the theater is mainly for emergency delivery. It is not for all cases. So we believe if the hospital is established, that means even the size of the theater is going to improve with the equipments and all the requirements to run it, to manage a theater that can do general operation. Because there are a number of clients now, like this one, yes, she's complaining of having something like hernia.
As a result, the facility, which is a referral point for nearly all patients from the rest of the 64 islands, has to routinely refer patients to the nearest destinations: Entebbe Grade B Hospital, which is 3 hours travel, and Masaka Regional Referral Hospital, which is also 3 hours away. The Chamswa County MP, Carol Nanyondo, says government is fully aware of the state of affairs in Kalangala, but nothing's yet to be done.
We have talked with them. We have written to them. The minister herself has visited the islands, but we are not seeing anything being done on ground. They keep on promising year in, year out. This financial year, we are giving you health center tours on these islands. but we are seeing nothing on the ground.
By 1997, only 47% of the population who needed health care could access outpatient services, and by 2016, 86% of the population were within 5 kilometers of a health facility. Helen Nachimul, a community development officer in the area, says this is entirely not true given Kalangala's geographical location.
Really, really different from all these other districts. So if we are really given a hospital, if government approves and gives us a hospital, that will be the best when it comes to health. Because yes, other things, I won't say they are perfect, but at least health. Our people are dying on the lake because we don't have a hospital. If we get a hospital, yes, we have health center for us, but hey, they are not really so fully fledged.
The area MP says the islands desperately need water ambulances to aid expectant mothers who often give birth on boats or at landing sites while waiting for help.
When government tried to give out ambulances some 10-15 years back, they gave Chamswa a car ambulance. We have no ship. We use boats. For example, Chamswa Healthy Center 4, it has no water ambulance. If a mother is in labor and cannot give birth from that Healthy Center 4 facility, he's referred to either Entebbe or Masaka. But there is no boat, there is no water ambulance. So the mother has to look for a wooden boat and an outboard engine, look for the fuel. So reaching Entebbe, it may be very late, or Masaka, and it has caused a number of deaths.
The islanders say the lake is often calm around this time of year, but the season between May and July is rife with accidents. James Banada, a medical clinic officer at Mazinga Health Center 3, one of the islands in Kalangala, says they sometimes refer patients on basis on where they can afford to reach, but not necessarily where they can get the required services.
If it's going to Masaka, we can refer to Masaka. If we prefer to go to Entebbe, possibly we refer to Entebbe. If not possible, then we can refer to Kalangala. We always call for the ambulance at the near landing site like a Daje, and then we put on the patient on the boat to Daje, possibly. And possibly we always refer pregnant mothers who are in labor, then in accompaniment with the midwife. Yeah.
Some patients like 53-year-old Rose Ebong cannot afford to travel to health facilities she has been referred to. Yet, there is no health center at the islands that can afford her the requisite treatment. Ebong, who is looking after her 5 orphan grandchildren, is ailing with a strange condition that causes red, scaly patches to appear on the skin. A doctor at one of the health centers where Ebong has been attended to told NTV that she has likely lived with this condition for ages, but it only worsened recently. She has also been diagnosed with hernia, and an operation has been due for the last 3 years, but she cannot raise money for that as well.
I don't apply the oil, I can't sleep. I wake up during them. At times, at dawn, people are already asleep. I just stay there, wake up, again I rebathe, then apply the oil. Every time in my life it is with the oil. The oil can be softening the skin. That is when I can go back to bed like that. I cannot stay without oil. I cannot stay for an hour without applying oil in my body.
More than once, Ebong has been attended to at Chamswa Health Center 4, where her transport costs 12,000 shillings. However, the doctors say they cannot do much for her.
This patient here has been with that condition for almost 36 years. It is not a new problem. She has been having it, but I think she has not got the right treatment yet. Even when she comes here, we give her some steroids just to reduce the symptoms.
The residents here share stories of pain and anguish. Women give birth at home because health facilities are far-flung, while others give birth on untidy boats during sale.
Abakyala bano abazaala basanga nnyo obuzibu kubanga olubuto ddo tirubeerako na ssaawa we lutandikira kuluma. Ogenda okwesanga nga bwe lutandika nti kuluma muntu nga obusobozi kubanga n'abazaalisa bano abamulerwa ku bizinga abamu tebabeerayo.
Bangi nnyo abazaalidde mu maata olw'entambula.
oba ku mwala awo kubanga waliwo kati tulinako ekyalo ekiri awo engulu awo bagenda bajja batuusawo ku maato oluusi entambula ebuze basomosa azaalirawo ku nnyanja kwennyini naye nga tetawaliwo wakyafu twetaagisa mukazi kuzaalirawo.
Health Minister Jane Acheng told Parliament last month that Kalangala is among the districts that deserve special attention because of its geographical location, alongside other districts such as Buvuma, Namayingo, Mayuge and Namisindwa. But it is not clear yet when the Health Ministry will provide funding.
When resources are available, the Ministry of Health will prioritize these districts first. The estimated startup cost per hospital for construction, human resources, medicines and medical equipment is Uganda shillings 31.3 billion.
It's come as is inspiring at the moment, and you can assume that road traveling by the lake from Kalangala to Masaka to get further health care for her pregnancy, that's okay. But there are times when the lake is menacing and the waters are rough that even the experts in the field fear to trade. Uganda's health care certainly has improved, but in an environment whereby patients critically referred to other places and pregnant women have to travel by boat, this leaves a lot to be desired.
As she commences her journey out of the islands, Nancy counts herself lucky. Not even the clatter of waves that pushes against the ailing boat can scare her. Yet, many of her colleagues remain trapped in despair at the islands without any help in sight. Frédéric Musisi, NTV Panorama.